There is an epidemic of obesity in the U.S. As people get older, their risk for diabetes and diabetes complications will expand like their waistlines. The average weight of 5'9" men in 1960 was 160 pounds and is now 195. The average weight of a 5'4" woman in 1960 was 140 and is now 166. The CDC estimates that 69% of American adults over the age of 20 are either overweight or obese. The complications of diabetes with obesity include premature aging of blood vessels, nerves, kidneys, and the immobility that goes with the weighing too much. With this looming potential for catastrophe, we should first ask the question, why is this epidemic happening? Is it because of genetics? Adoption and twin studies show that we usually weigh what our biologic parents weigh, not adoptive parents. But this doesn't explain why obesity is increasing. There must be an environmental factors to explain this upward trend. Is it the lack of activity of today's youth? Is it the food that pregnant mothers eat which nourishes their babies in the uterus before birth, or the way we feed babies in the first months after birth? Is it high-caloric, starchy fast food? We simply don't know why this epidemic is occurring. Still, is there something we can do? Repeated studies show even with the best programs, only 35% will lose significant weight. And over the following year, only 10% of the original number will keep it off. And over the following 5 years, they'll all return to the original weight. Nothing seems to work short of surgery, which is dangerous, and over time, at least 50% of those people will regain their weight as well. We can therefore infer that weight loss programs are either ineffective or potentially very harmful, especially if people are shamed or criticized into trying them. My recommendation for obese people, especially if they have or are predicted to have diabetes, is to take or give no criticism of individuals who are overweight. The value of each individual has nothing to do with weight and all to do with the heart. What remains most important is that obesity may not go away, but diabetes gets better when we eat right, a balanced diet, lots of vegetables, low calorie, exercise daily, like a brisk walk 1 or 3 miles a day. We should all forget about weight as the goal. Lifestyle should be the goal, along with loving yourself the way you are.